I'm DocBott, veterinarian and animal conservationist. I see patients, house pets to exotic animals to animals on the farm. Each animal has a story, some with heartbreaking stories that test my feelings as an experienced veterinarian. Others that bring happy reunions with their animal and human families. Join us here on Flash TV. I'm DocBott. Stepped outside here to check on the reindeer here at Mountain West Animal Hospital. We have 7 resident reindeer. This is Titus right here behind me. Titus is 2 years old. He was born here at the hospital. He's a male. This time of year their antlers grow 1 to 2 inches per day, and they're incredibly sensitive right here. They're spongy, they're flexible. You can grab them and actually pull him. As he shakes his head, you can kind of see him vibrate. As the antler growth ceases, they harden, calcify, and they're actual bone at that point. So it goes from something like this, where it's spongy and soft, to something like this. Reindeer are unique in that both males and females have antlers. They're the only species where both sexes have antlers. This is the time of year that they're just losing all of their winter coat. They look really, really shaggy. By next week, though, they're going to be all just sheen, and they'll be a dark, dark brown.
No, she's just playing with Ray. Okay.
You guys, we'll feed some reindeer. You guys want to feed some reindeer outside? Yeah. I just got a whole bowl of apples. You guys can just come with me if you want to just follow me. We'll go outside and feed them. Did you know reindeer like apples?
Yeah.
Well, let's go see if they're hungry today, okay?
They like carrots.
And carrots, yeah. Now, reindeer only have teeth on their bottom. And so if Sven bit me, it doesn't hurt. See that? And they've got funny lips. This is Titus right here. He only likes this. He likes red delicious apples, and that's all. He's really picky. Sven doesn't care. You see how funny their lips are? There you go. This is his favorite treat. These are my pets. Aren't they cool?
Yeah.
You can tell he likes them, can't you? You guys ever seen reindeer before?
No.
All right, we gotta feed the reindeer.
What do you guys say?
It's good to see you. You guys have a good day, okay?
He will.
Take care, and we'll see you later.
Come on, Charlotte.
Loki has been losing hair for some time. Ever since her last set of puppies were born, she required a C-section. We had to spay her at the time of that C-section. She's lost a significant amount of hair. She came in this last week and we took some radiographs, and there is something around her spleen. It looks like a pretty good sized tumor. And so we're going to do what's called an exploratory surgery, where we open the abdomen and explore. We look to see what in the world is going on. We did run a full blood panel. We checked her thyroid, checked for other endocrine disorders that can cause hair loss, and everything is normal. She did have high calcium, and unfortunately, high calcium in the blood can be associated with malignancy or cancer. So I'm very concerned about Loki, and I'm hoping for a good outcome with this surgery today. You never do know what you're going to find when you get in there. And surgeries like this can be very, very stressful for me as a veterinarian. But you just find it, take it out, and hope for the best with her recovery. And there's a splenic nodule right there. So I pull this out. You can see this is not a healthy looking spleen. So the best thing to do is just remove it. So that's what we're going to do. You can see these little plaques here. So just overall, just the general appearance of this, it's bigger. It's more congested than normal. This is probably what we were seeing on an x-ray right there. So what we'll do is we're going to remove this spleen, and then we're actually going to just finish exploring the abdomen and see if there's anything else that we need to remove. Okay, we're going to have some bleeding here, so just from the spleen though. So be alarmed. Okay, so this spleen is probably about double the size it should be. Actually a little bit smaller since we started the surgery. So we'll submit this spleen, we'll look at it and see what in the world is going on. We're gonna get some fluids running right now too, just to make sure that she's gonna be okay hydration wise and keep that fluid status normal. I'm just going to put that wrap on to just kind of apply some gentle pressure to the abdomen for some of the seeping that we encountered during this surgery. It's a normal amount. Nothing really particularly concerning happened during the surgery. Minimal loss of blood overall.
We noticed a few days she hadn't been eating her food.
Hi, baby girl. Hi, baby. Oh, where do you feel better, huh? Where do you feel better? Oh, where do you feel better?
Bye-bye, sweetheart.
She's low key.
Yes.
Okay,
Have a
thank
good
you.
day. 30 days, that's fine. Do you want me to get the ultrasound stuff ready? Okay.
This is Margot. And my little guy on the floor is Rusty. We're all so excited to find out if she's gonna have babies.
Oh no, little puppies.
So excited.
Okay, I'll let Dr. Bott know that we're all ready for him.
Okay. This is Margot. So excited to find out if she's gonna have babies.
Oh no, little puppies.
So excited.
Okay, I'll let Dr. Bott know that we're all ready for him.
How are you guys today?
We're good.
Well, we get to see if
Yes.
our artificial insemination was successful.
Yep, we're hoping for good news.
Yes. How is she acting? Any behavioral changes?
A little bit. She has, I don't know if it's just me hoping. She's a little bit slower, a little more of an appetite. She's not jumping on things as much as she used to, so.
She has been sleeping a lot more.
Oh, she sleeps a lot all the time.
I don't feel anything. Gosh darn it, we'll take a quick ultrasound and see. Alright, we have to make her lay on her back. Hey, sweetie, you're okay.
He's gonna try to get more tricky.
Okay.
Just do a quick ultrasound, okay?
She's gonna be okay.
So I'm just going to look at both sides of this uterus on both horns.
Okay.
Actually, there is one puppy right there.
Really?
Yeah.
Oh. One puppy would be.
Margot, it's okay, baby. You're okay. It's okay.
So this is kind of a high-risk pregnancy right here. Yeah, there's one right there. So we're just going to want to watch. I'm going to want to. Good. See the heart rate right there fluttering? I don't know if you can see the round black circle on the left side, right at the very top.
So you only see one?
That's all I can see.
Okay.
Ultrasound, sometimes it's tricky
Sometimes
to
it's
count.
hard to see them.
And so generally what we do is we take an x-ray at about day 50 to day 55.
Okay.
The heart rate and everything is okay. But I do see a lot of pregnancies that terminate
Okay.
at this, especially when there's one or two. It just seems to happen more frequently, and I don't know why, but on the caseload that I see, a lot of this, 1 and 2 puppies.
When there's only one or two.
will kind of abort.
Yeah,
And you don't
you
really
know-
see anything, you wouldn't see any
You wouldn't
discharge
be
or
able to
anything like
tell.
that. It just kind of
Okay.
is reabsorbed into the body. Gonna be
Huh,
healthy,
we're
so.
just gonna wait another 3 weeks. Just crossing our fingers.
Well,
Yeah,
good.
just
At
crossing
least
our
there's
fingers.
something in there.
Good girl.
Margot was confirmed to be pregnant. I could only see one fetus on ultrasound. I actually artificially inseminated Margot about 30 days ago. reproduction in veterinary medicine is called theriogenology. It's a fancy scientific word just to be an animal reproductive expert. And so I actually, as a veterinarian, perform a lot of reproductive work in a wide variety of species. So in my typical day, I do have reproductive cases, dogs and cats, reindeer, sheep and goats, elk, bighorn sheep, and it provides a huge variety for me. It keeps me absolutely engaged in what I'm doing, and reproduction to me has always been really a fascinating area of veterinary medicine. So on Margot, I can only see one fetus. I am concerned that that puppy will be big. It seems that a lot of the single pregnancies where there's just one fetus, the puppy seems to be abnormally large compared to a litter where there's several. So that's something we're going to watch very, very closely. With these pregnancies, my recommendation to my clients are that we ultrasound at day 30. And this is assessment of the fetus. We're looking at heart rate. We're just looking at the attachment, make sure everything is normal. And then at day 45 plus, you can take an x-ray and actually see bones of the puppy and count how many fetuses there are. I have a really nice digital x-ray system here, and I like to take my x-rays between 50 and 55 days. I'm able to very accurately count how many puppies there are, and I'm able to actually measure their head versus the size of the pelvis, and a lot of times we can predict whether or not there's going to be any birthing difficulties. Well, I'm going to give her a tick preventative that will kill these and they can fall out.
Okay.
It's very, I mean, you can go through and look and look and look, but she needs to have a tick preventative that will kill these. And it's just a pill, an oral pill. So he has kennel cough, but he's obviously developing pneumonia right now, okay? The discharge you're seeing from the nose, and I can hear congestion right down here in these lower, what are called the ventral lung lobes.
Our friend's puppy just had pneumonia.
Yeah. So it starts, you know, as kennel cough often, and it progresses to this. And so this is kind of serious. We're going to have to treat really aggressively with antibiotics, and I would expect to see immediate improvement. If we don't, then we're going to have to hospitalize and do IVs and things like that. I can take x-rays and just see how severe the pneumonia is. I'm going to leave that up to you. I can start treatment also. We do have a fever.
How long do you think it's been going on? Because he's only been showing signs for like...
It could just be just a couple of days.
Yeah.
Yeah. This can really progress fast.
The ticks aren't going to jump off on me, are they?
No, I'll give this pill. They're not. If you want me to, we can look through, but the best thing is just to give this pill, and it lasts. It's just kill everything that's on there, and it will prevent ticks from getting on for the next 30 days. Malloy has a touch of pneumonia, started as kennel cough, and I can hear some congestion inside the lungs. So we're going to treat pretty aggressively right now. I don't want this to get any worse. We do have dogs pass away from pneumonia, and so it's something that we have to really watch close. My instructions are that we're going to give these antibiotic injections, and we should see major improvement within the next 12 to 24 hours. If not, we're going to have to hospitalize Malloy and actually do an IV, probably some oxygen therapy, try to get us feeling better. Good boy. Being a sickie, you're being really good today. We removed a very large mammary tumor from Georgia. And Georgia is a bull mastiff, a huge dog, 140 pounds, incredibly heavy. You don't realize how heavy a dog is until they're anesthetized and you have to lift them up on a surgery table. But Georgia has had this big mass for some time, and I assume that it's mammary adenocarcinoma. It's actually breast cancer, the dog form. And we wanted to remove it, to do the best job that we could to make her life comfortable as long as possible. That bleeding is to be expected. These cancerous tumors create their own blood supply, and often they'll have huge arteries that go to them, and that was the case today. Blood spraying, definitely not a surgery for the faint of heart. It was a surgery that was very intense, lots of bleeding. She did very well though, and that bleeding is to be expected. These cancerous tumors create their own blood supply, and often they'll they'll have huge arteries that go to them, and that was the case today. And the best way to avoid something like this is to spay your dog. Each heat that they go through exponentially increases their chances of developing mammary cancer. And that's probably the biggest health benefit of spaying, is reduction in occurrence of mammary cancer. And the earlier you spay them, the less likely they will develop that. You don't ever want to spay a dog before they're 4 months of age. That's kind of a rule. And also, you want to do it before their first heat. That's maximum reduction. Tumors like this produce what are called angiogenic factors that make their own blood supply. So it's very common for these tumors to have arteries and veins that form to basically prioritize feeding this tumor. And basically starve the dog to death eventually of nutrients. She is very stable right now. Everything's going quite well. But I am just removing this as quick as I can so I can ligate these vessels. It seems like the longer I take here to get this on board, the quicker it is. And this is a huge vessel right here. There we go. The bleeding now has ceased and I have everything clamped off, which is good. And now we're able to tie everything off and close this up. So Georgia came in a few weeks ago and we put her on antibiotics to try to treat this open lesion that was very infected. And today, the size of that tumor that we took off was only about half the size it was 2 weeks ago because of the infection and the swelling. These mammary tumors classically will grow, and then the outside of that tumor will begin to ulcerate and kind of slough off. And you've got an open draining lesion at that point, and that really is when it becomes uncomfortable for dogs. They will start to bite at the tumor, try to literally physically bite the tumor off. I see that commonly. And if you've got an open draining sore, then you're going to be prone to infection. Anytime you have a pet, you need to really do a thorough physical examination at your house. Of course, going to the veterinarian is imperative. You should go every 6 months to a year with every pet that you have. And every time I examine a pet, I'm looking for tumors and masses. Mammary cancer is very aggressive and it metastasizes very quickly. It can go to the lungs, it can go to the bones, almost anywhere in the body. And on Georgia, we don't know if it's spread. With x-rays, we do not see any evidence of tumors in her lungs. But just because I don't see tumors on an x-ray doesn't mean that they're not there. The difficult thing with cancer is all it takes is one cell. If I leave one cell of cancer inside her body, it still has the potential to regrow a tumor in that same spot or elsewhere in the body. It can travel to whatever organ it goes to. And so for George's well-being, we hope that we got everything. And again, how we assess that is by submitting that tumor for histopathology and biopsy. And that would tell us if we were able to remove the whole thing or not. And with that, if it has spread, then we're just going to have to reassess and see. There are veterinary oncologists that exclusively deal with cancer in pets, and they can implement chemotherapy protocols, different radiation treatments. There are myriads of different types of masses that dogs get. Some are malignant, some are benign, some are harmless, some are dangerous. The earlier you catch something, the easier it is to treat and the better outcome. If you wait until there's a large tumor that's 2 or 3 pounds hanging from the belly, removing that is not going to produce as good of an outcome as if it were the size of a golf ball, for example. Really, 2 things you really watch for with your pet is that if there's any change in appetite or energy level, that is the first sign that something is wrong. And many of the illnesses that I see, those are the very first things that do change. And owners that are astute enough to catch that and know their pets, they'll come in and say, "Hey, Dr. Bott, my cat's acting different." And that's all they can tell me. They say he's not his normal self. And that's where my training comes in, is that I observe, and veterinarians were trained incredibly well in observation. These pets can't talk to us, and so we have to be able to look at them and feel them, and from their body language and their posture know exactly what's going on. Sure, we can run diagnostic tests and stuff, but I think veterinarians are some of the most uniquely trained professionals in the world in how we have to diagnose our patients. You know, I'm doing okay.
That's good to hear.
Sounds like we got to our incision site though.
Yep. Well, I think he could water like disintegrate them stitches.
No,
No. So we
no,
have to be licking it.
definitely licked it. Yeah.
Because he's had the cone on the whole time, but he has such a long neck. He
Wonder if he's got around it. Yeah, wow, you just came around right there.
Tight, Mom.
We're gonna just. She's held a couple of animals for me
Oh,
before.
look at her guns.
Oh,
Okay, we're gonna go like this.
dingus. Take it easy, buddy.
Strong little dog.
Take it
He
easy.
is very strong for a little he is.
Okay, so these staples sting, but often trying to numb this area before we put staples in stings worse. So.
Good boy, Jingle.
Okay.
There you go, buddy.
All right, Dingus, you leave those alone. Staples are great.
Okay.
If we lick a staple, it hurts. Versus stitches, dogs seem to be able to just lick stitches.
So his neck is so long, I've noticed he can, if he really tries, he can get to it with that cone on.
Making sure he doesn't
I've been trying to keep an eye on it.
lick, just do your best. And about 10 days when they take those staples out.
Okay, sounds good. You want me to cone on?
And just watch, if he stops eating or gets lethargic or anything, let me know.
Through the battle with that cone, that's some battle over that. Look at that, that's crazy.
Oh,
So
yeah.
my legs. from him.
Has he been running into you?
Oh,
He
yeah.
runs in everything with it on her to be finished there. He fights
Oh,
with it.
buddy.
Okay, Dingus, you leave that alone, bud.